My name is Kent Kingsley, co-owner of MyMedigapConsultant.com. Thank you for taking a little bit of your time today to watch this video regarding the basics of Medicare. I get phone calls all the time from clients and potential clients that are transitioning into Medicare for the first time, and they are just highly confused. So hopefully what I plan to lay out for you today are some of the basics of general Medicare, what it is, how much it costs, when you should enroll, when you shouldn't enroll. So hopefully a lot of that will clarify a lot of the general questions that you have. So I've put together a little presentation, so let's take a few minutes and just go over that. Thanks. Okay, let's get started. If you'd like to grab a sheet of paper so that you can jot down a few notes as we go along, please feel free to pause the video and take some notes. That way when we do talk, hopefully in the near future, you'll have those questions readily available, and I can clarify anything that has come up that I might not have addressed in this video or you would like further clarification on. Some quick terms I would like to start out going over is Original Medicare. Original Medicare, you'll see that thrown around a lot. That simply is your Medicare Part A and your Part B. When you receive your Medicare claim card, it will show your Part A and Part B effective date. That is your Medicare insurance. That is Original Medicare. So you'll show that to the doctors and hospitals when you are on Medicare. Another term I'd like to address is a Medicare supplement plan. It's also referred to as a Medigap plan. So those two terms are interchangeable. Also, a Medicare Part C plan is also known as a Medicare Advantage plan. I want to point out also that a Medicare Advantage plans are not the same as a Medicare supplement plan. I talk to a lot of people and they'll say that they have a Medicare supplement with AARP, and only to find out in further talking to them they really have a Medicare Advantage plan. So I want you to get those two different products. Make sure you don't associate them as being the same. I've got another video coming up later on that addresses the differences between a Medicare Advantage plan and a Medicare supplement. So be on the lookout for that one. So let's take a quick look at the parts of Medicare. The first part is known as Part A, which is your hospital insurance. So if you're in an inpatient situation at a hospital, your benefits are going to be covered under Medicare Part A. Medicare Part B is referred to as medical insurance. This covers doctors, outpatient services, MRIs, CAT scans, things of that nature. So those claims will be paid out under Medicare Part B. And as I stated earlier, Medicare Part A and Part B, that is your original Medicare. Part C is a separate benefit plan that is issued by carriers, and it simply replaces your Part A and B for you, and now the carriers manage your original Medicare for you and deliver the benefits in a one-type package product. And then finally we got Medicare Part D. This is referred to as your prescription drug plan. So you would have a prescription drug plan when you have original Medicare to cover those prescriptions. Now you've probably also heard people talk about Plan F, Plan G, or Plan N. If you hear the word plan, that should be referring to a Medicare supplement, also known as a Medigap plan. These are supplemental plans that supplement your original Medicare to cover the gaps that are not covered by Medicare, and we're going to go over that here in a second. When can you enroll in Medicare? This has been a big confusion for a lot of people lately. So for the parts of Medicare, Medicare Part A, B, C, and D, you can enroll in this 3 months prior to the month you turn 65, the month you turn 65, and up to 3 months after you turn 65. That is your initial enrollment period. For a Medigap plan, a lot of carriers will allow you to apply up to 6 months prior to the month you turn 65, the month you turn 65, and up to 5 months after you turn 65. Anytime during that period, you would be able to enroll in a Medicare supplement plan of your choice without underwriting questions. Now, I do recommend you you do all this early so that by the time your Medicare starts on the first of the month, whatever month it starts, your Part A and B, that you got everything in place and you don't have to worry about getting your ID cards and all that stuff. Now let's look a little bit further into Medicare Part A. Again, this is your hospital insurance. For most people, there is no cost to Medicare Part A. You will be automatically enrolled in Medicare Part A as well as Part B, and we'll address that in the next slide. But both Part A and B, you will be automatically enrolled if you are currently drawing Social Security. If you are not drawing Social Security and you delayed that, say you wanted to wait till you're 66, 67, 70, whatever, whenever you do, if you are delaying that Social Security enrollment, you will need to apply for Medicare Part A and B, and you'll do that online. So I would recommend just pausing the video right here, taking these few notes if you need to enroll in Medicare Part A and B. Go ahead and jot that website address down as well as the phone number. The easiest thing to do is just to do it online. It's pretty straightforward. So under Medicare Part A, what are you responsible for? You do have an initial deductible of $1,316 for every hospital stay. Now, if you are in the hospital for that $1,316 will cover you for the first 60 days that you're in the hospital. So if you're in the hospital, let's say for just 5 days, and let's say 3 weeks after you're released, you had to go back. Well, you've already met your $1,316 deductible, and your 2 visits were within that 60 days. So you would not have another deductible for that period. On the flip side, though, if let's say you were in the hospital for 5 days, you were released, and then for some reason, let's say 4 months later, you had to go back to the hospital, then you would incur another $1,316 deductible. Now, if you're in the hospital for more than 60 days, then you have a copay per day, and it's quite expensive. Days 61 through 90, you would be billed $329 per day. And days 90 on, you would have a copay of $658. Now, if you're in the hospital, inpatient for more than 3 days, and let's say they release you to a skilled nursing facility, Medicare will cover the first 20 days of skilled nursing facility charges. And then after that, for days 21 through 100, you would be responsible for $164.50 per day. So again, these charges are typically referred to as gaps, what Medicare does not cover. So I just wanted to point out the highlights of Medicare Part A. These are the main charges that you would be associated with under Part A. Now for Part B, it's, as we said earlier, referred to as your medical or doctor insurance. Most people pay $134 per month. If you have a higher income and your income is based from what it was 2 years prior to when you go into Medicare. Anybody under $85,000 that files single, and if you file jointly, if it's under $170,000, you would have $134 per month premium for Part B. That is typically taken right out of your Social Security if you are already drawing Social Security. If you are not, then they will bill you quarterly for your Part B premium. So again, if you have higher than $85,000 filing single or filing jointly, if it's over $170,000, you can check out our website under the Part B tab, and I've got a chart in there that shows you what that additional premium would be. But again, for the majority of people, it's $134 per month. And same thing with Part A. If you need to, if you're not drawing Social Security, you will need to enroll. You would enroll in both Part A and B at the same time at one of those 2 options that are available there. I wanted to point out that there is a lifelong penalty if you decide you do not want to enroll in Part B. You cannot just go pick that up at any time. There are certain periods when you can get back and enroll in Part B, and if that is the case and you do enroll, you would have a lifelong penalty that would follow with you if you did not have an exception. So you would want to defer your enrollment in Part B only if you have employer coverage from a creditable sponsored plan. That would allow you to defer your Part B premium, and you just contact Social Security and let them know that you're still working, you're covered by your employer plan, and you would like to stay on that plan and defer your Part B. That's perfectly fine, and obviously you don't want to be paying both premiums. However, I would suggest you to, whether you do it yourself or you contact me and let me walk you through it, I'll give you an honest assessment of the two options. But it's very important to compare your current benefits and the premiums that you pay and what your exposure is to what your benefits would be with Medicare and what your exposure would be there. Sometimes it may be better for you to stay on your employer plan because the employer pays the majority of your premium and you got great benefits. And sometimes it might be better to go on Medicare because maybe you do pay more, or you have a lot of health issues and you've got a high out-of-pocket exposure on your current plan. So I would encourage you to look at that. If you have any questions on it, then you just could give me a call as well, and I will go over that with you. So under Part B, again, this covers your medical insurance like doctor visits, specialist visits, CAT scans. What are you responsible for on that? You have an initial deductible of $183 per year. That's a calendar year one-time deductible. Okay, so that runs from January 1st through December 31st. Once you have met that deductible, then Medicare pays 80% and you are responsible for 20%. And it's also important for me to note here that on that 20% that you are responsible for, there is no cap in what your exposure can be. So in other words, if you had a Medicare Part B claim, let's say it was up to $50,000. Of that $50,000, you'd be responsible for $10,000 of it. So again, there is no stopgap on that. So as you can see with both Part A and B, if you don't have anything with Medicare and you just go with the original Medicare Part A and B, you are setting yourself up for potentially very high claims down the road as you do use Medicare. Okay, so let's go over how you can fill in the coverage gaps of Medicare that we just went over. There's two ways to cover these gaps. One is the most recommended option by us, which is staying with original Medicare, your Part A and B, and then supplementing those gaps with a Medigap or a Medicare supplement plan. These plans cover those gaps as much as up to 100%, depending on which plan you were to choose. You could have 100% medical coverage with a original Medicare and a Medigap plan. If you went with that route, then you would also have a Part D drug plan to cover your prescriptions. The other option is a Medicare Advantage plan. Now, a Medicare Advantage plan doesn't necessarily cover all the gaps. Medicare Advantage plans, if you recall when we talked about it earlier, it replaces your Part A and B of Medicare. However, you do still have your Part B premium, so don't think you're getting out of that. But now you have given your Medicare rights to an insurance carrier, and they in turn are managing your original Medicare for you and delivering it to you in a way that you would have co-pays for certain benefits, co-insurance for different benefits, and they would also have some type of stopgap on it. But now you are under the control of a Medicare Advantage carrier rather than Medicare. So again, we'll get into both of these options in a later video talking about Medigap versus Medicare Advantage. So once you finish this video, then be on the lookout for that one as a future video as well. So what's the next step? As I said, hopefully you've taken a little bit of notes during this presentation. I encourage you to continue watching the videos that follow this one. With your notes, feel free to drop me an email if you want to go ahead and get some of them taken out of the way at kent@mymedigapconsultant.com, or simply pick up the phone and give me a call at 888-557-4812. That rings directly to my mobile phone, and I'm available pretty much most of the day during daylight hours. So 8 a.m. to 8 p.m. is a good time to contact me. Again, continue to watch the videos, take some notes, and I hope to hear from you soon. Thanks for your time, and I hope you have a wonderful, blessed day.